With the first session today, we have our cancer patient panel and caregiver panel. And so we're going to go through a couple of questions here, and then we'll open it up for other questions for anyone in the crowd or on the WebEx. So we have first Linda Grush, and then Norman Dinkle, James Terry, and Missy Hedges. So the first question is, please share with us a little bit about your stories, how and when the diagnosis was made, and any treatments you've undergone or are currently on. So we'll start here with Linda.
Hi, my name is Linda Grush, and I was a caregiver for my husband Eric for close to 3 years. He was diagnosed in 2010 with stage 4 stomach cancer at the GE junction. And he went through multiple types of chemotherapy. He also had the Ivor Lewis surgery after he responded to chemotherapy. And then ultimately he had a recurrence and was able to participate in 2 different clinical trials to try and continue to fight stomach cancer. Unfortunately, he passed away in July of 2013. I'm here as a caregiver and also in support of the people who are fighting stomach cancer.
Thank you. James?
Good morning, I'm James Terry. Almost everybody who knows me calls me Jimmy. I don't know why it says James, but that's fine. I was diagnosed with stage 4 gastric cancer in 2009, August 19th of 2009. The outlook was not very good at all. I've traveled to all the big hospitals all over the United States to try to find a cure or help for my cancer, and I didn't find it anywhere outside of Chicago. Northwestern University is where I found the help that took my stomach out, took out part of my liver, took out a lot of my lymph nodes, and 7 different cycles of chemotherapy and 6 weeks of external beam radiation, and here I am. So happy to be here today.
Great, and we'll go into more as we get into the next question. So how about Norm?
Good morning, everybody. My name's Norm Dinkle. My late wife was diagnosed with stage 4 stomach cancer August 23 of 2013, and she passed away June 27, 2014. Her symptoms, in retrospect, if we look at it, were ignored by most doctors as either allergies, heart disease, when in fact it was stomach cancer. So if I can give anybody a little bit of advice, and I don't have to give advice, but if you got any kind of conditions that are, even though they don't reflect on your stomach, get your stomach checked out. But my wife was a fighter. The afternoon at Evanston Hospital, of course, I was pretty sad, but she just had that positive attitude. I said, we're supposed to go to our good friends for dinner. I said, we can't go. She said, well, I'm not cooking dinner. So she set the tone at that time that she was not going to miss a beat. She was going to live life to the fullest, and she did. So if that's a lesson for all of us, is that whether we have cancer or no cancer, we gotta live life to the fullest and enjoy every moment.
Words to live by.
I'm Missy Hedges. I am a mother of 2. I'll talk about them in a little bit. In November of 2012, I was diagnosed with osteosarcoma, which is a rare bone cancer in my right wrist. I went through 17 rounds of pretty intense chemotherapy and surgery. A year later, I finished my treatment in September of 2013, and in 2014, almost a year to the day after I finished treatment, my stomach started bothering me. I talked to several of my doctors at different times about this. We all sort of chalked it up to, acid reflux. I was, had just turned 50. It was sort of, I thought it was a symptom of having so much harsh chemo the year before, and really was losing a little bit of weight and having stomach problems eating, but did not, it wasn't dramatic. It wasn't like I dropped 10 pounds in a month. So over the course of the next 6 months, it got worse. I started having trouble swallowing. And when I went to see my OBGYN in February of this year, she was concerned and wanted me to have an endoscopy. It turned out I had a scan for my osteosarcoma because my lungs are scanned every 6 months to make sure the cancer hasn't returned there. And at that time, they saw swollen lymph nodes and fluid in my upper abdomen where I was experiencing pain. That led to a CT scan which showed a thickened stomach lining, and my stomach was really shrunken, which is why I couldn't eat. And that led to 2 endoscopies, biopsies, a laparoscopy. And in March, I was diagnosed with signet ring cell carcinoma in my stomach and it's some mets in my peritoneum next to my stomach. So it was extremely shocking. The cancers, they had to have 2 rare cancers in, 3 years is quite unusual, I suppose. And you really like to be a special person, but not in that way. Let's put it that way. So that's my story. I have been in treatment since April, and I had 7 rounds of FOLFIRINOX, and then I have now had 5 rounds of FOLFIRI. We dropped the ox in July. So I've now had 30 rounds of chemo in the last 3 years, and have responded well so far, knock on wood. So I feel very fortunate about that.
Thank you. And so just to go over, Missy mentioned that you had the cancer was lining throughout the stomach, and we're going to hear throughout the day that within the category of stomach and gastroesophageal cancer, there are different sorts of cancer. So, and you mentioned that you had kind of the diffuse one in the stomach. Can we just go through the other 3 and where the cancer started in each of the cases? Start, Linda.
So, GE junction.
In the GE junction, okay.
And mine started in my stomach.
In the stomach.
GE junction tumor.
And then yours was a diffuse throughout the stomach. So that's kind of a representation of all the different possibilities that we see and may resonate with different patients out there. So the next question is, what would you say is the greatest challenge you faced as a patient or caregiver?
I think the greatest challenge is to be an emotional support to a person who is going through such an intense disease. They are trying to make decisions all the time in terms of their care and lean on you for support and feedback. And it's just hard to be present and to be caring for them physically, but also to be helping them in that emotional aspect as well.
For me, I spent 6 years in the United States Army, so I worked with the 75th Ranger Battalion that was in Somalia and in Desert Storm, so I knew a lot about physical challenges, but raising 3 boys and watching my wife deal with me dying of cancer, because literally at one point, I was dying of cancer, was probably the biggest challenge. Living without a stomach, when you're a 225-pound farm boy from central Indiana and you're used to eating your mom and dad's meat and mashed potatoes every Sunday afternoon, and they take out your stomach, that's pretty challenging right there. How do you eat? And your clothes don't fit. You want to eat because you need nutrition, but you can't eat. And, so I would say the biggest challenge for me it's been watching my family live with my cancer. But then close second would be living and staying alive without a stomach.
Okay. Norm?
Well, first of all, I admire anybody who fights this disease, and I pray for all of them, but no one ever plans in their life to become a caregiver. That's not part of the wedding vows in sickness and in health. I never paid much attention until all of a sudden on that August day my life changed and I became a caregiver. And my goal at that time was to become a good support person, because in the following months we had a lot of ups and we had a lot of downs. And I had to train myself to keep calm, which is very hard for me because I'm a type A personality. I had to stay positive. And when we're in those worrisome environments, to change those environments. And I'll just give a quick example. When we went through chemo, we brought in an iPad so my wife could do FaceTime with some of her friends. We brought in some games, a little dice game called Heck Mech, which it's a lot of fun. It's a good dice game, and it gets your mind off what's going on. And then made sure that we kept a positive, active lifestyle, because everybody's got to keep on living. So that was my goal, and I tried to do my best of that.
My daughters are 12 and 15. They're in 7th and 9th grade. My biggest challenge, and I think what my husband and I try to do every day, is to keep life as normal as possible for them. They're adolescents. They're at the age where they're separating from their mom and being, 1 minute they're chatty and the next minute I'm getting a monosyllabic response to an innocent question of what would you like for dinner. So it's challenging because we don't want to frighten them. And the good news right now is that I look good. I have not lost my hair like I did with my last cancer. The chemo is, wearing on me, but it's more fatigue than anything. So I'm able to do most of what I would normally do with them. And so that is good. And I think because of that, they're not worried, because they saw me go through this before and I came through it. And so their attitude to even when their friends say something, is, well, my mom's already done this once and she'll do this again. And we want them to believe that. But the biggest challenge, I think, for me, too, is that on days when I don't feel well, there's a very big tug of war to not say to them, I have cancer and you need to be nice to me. Because that's not really fair to put on them and their kids. So I would say that's what keeps me, up at night sometimes, is like Jimmy said, like your family. And, no one should have to deal with this, and children shouldn't have to deal with a parent being sick, and worrying that I'm not going to be there to raise them is a huge thing for me.
Okay, and just a reminder to the web followers that you can submit questions, and I'm happy to read them for the panelists. The next question would be, and some tips have already come out for others facing this illness, but what best tips or tip can you give to others who are facing this particular illness?
So I will answer this from the caregiver perspective, and I would say that it's really essential to have a point person that can be the person that will set up a website for meals if that's what you need, or make arrangements to have someone there because you're running late getting back from treatment to stay with the kids. Someone that you can rely on and lean on, because it's too much for a person to coordinate, especially if you're caring for family also. Just that I found that really helpful, to have some friends that could take care of that for me.
That's a great tip. I know my wife would be happy to hear you say that. For me, I guess the advice that I have given to others who are in my situation is, be relentless in finding the right help. I've traveled all over the United States looking for the right help. It wasn't until I found a group of people who were collaborating with each other that I got that help. So I would just say, be relentless and use the resources that are available. The Debbie's Dream Foundation website is part of the reason I'm still alive. There's no doubt in my mind. So there's resources out there. You have to look for them. You have to not be afraid. As a man, especially as a man, and a successful man, it's humbling to ask other people for help. It was for me. You know, in my little community that I live in, and even at the very large hospital that I go to, it's just hard for me to ask people to help me. So I just, you know, beg you, don't be afraid to ask for help, because it's out there.
Well, as a caregiver, and when the word spreads, you know, everybody wants to know what's going on, and it's hard to repeat. So my wife got onto a website called caringbridge.com. And what's nice about that website is that you can keep people updated about what's going on in your life and how you're progressing, your successes, your bad days. You get to vent it, and my wife maintained that. And then it also allowed for people who wanted to help. You sort of, they wanted to bring meals, they had to schedule it on the Caring Bridge website, so I knew what was coming. A lot of people want to help, and it's tough because you have stomach cancer, and you make your mom's favorite, you know, Hungarian goulash. That's not necessarily going to be the best thing. And then I formed a teamwork. And I'm lucky I have my daughters and a son who are all adults. One daughter was assigned research and development on the web to find out what's going on. Use Debbie's Dream website extensively, you know, pretty much most of it, but she was on other websites. We did attend Debbie's Dream Symposium down in Fort Lauderdale in April 2014. And then for every doctor session, for every meeting, it was a team event. My wife would go, I would go as a caregiver, and I brought someone as a note taker. A note taker is important because I'm not a good listener. My wife always told me I'm a terrible listener. And so being there and listening to the doctors tell you, you know, blah, 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 one ear and out the other. Thank God I had someone taking notes, so when we got out of there, what did that guy just say to us? And so that's very important, that if you can, develop a team. It's a family event. If you got close brothers, sisters, children, get them involved. They'll feel very important, and that's what I can impart. And then one other thing that I wanted to just say, I happened, Wall Street Journal had a book review a couple weeks ago. It's an excellent book. I advise everybody to buy it. It's called The Patient's Playbook by Leslie Mickelson. How to Save Your Life and the Lives of Those You Love. And whether you have cancer, or whether you have heart disease, or whether you have to go to the emergency room, or whether you've got a good thing. Years ago, my son is a teacher, but he ended up in Costa Rica for doing some research, and he came back and he was sick, and I thought he was malaria, and it affected one of his eyes. And we're going from one doctor to another doctor. No one knew what it was. We got on the web. We found a doctor from the University of Chicago, infectious diseases, and he had picked up some sort of parasite. And thank God that this doctor was doing research. So I just can say that it's, in all medicine, things are moving so fast, it's hard to keep up.
I agree with all the comments that have been made so far. So I guess the one thing a couple things that I would add, accept help. It's really hard for those of us who are used to doing everything. I know with my first round of cancer, it was very hard for my husband when my friends organized meals. We got something like 90 meals over the course of 9 or 10 months delivered to our house to feed my husband and my children, which was unbelievable from our community. And at first he said, I don't need any help. I can manage all of this. And he couldn't. It was too much to, be there for the kids and do all of those things. And he finally came around to that, and so did I. And I think sometimes it's really hard for us, for all of us, to like let people help us. But as everyone here has echoed, people want to do something, and you find the way and the resources and a point person. And I guess the other thing I would say, which has helped me, is that you have to remain optimistic. And by that I mean, you know, people will say to me, well, you got to be positive, and I want to look at them and punch them in the face, because I think you're not going through this. Like, it's easy for you to say. But in truth, these treatments are very, very difficult. And to stay alive with a stage 4 stomach cancer diagnosis, you know, you have to believe that you're going to make it through, because, you know, I get treatment every 2 weeks. And I'm doing really well, but I've had a lot of chemo, and it wears me down. And there are days when I feel, you know, just like I can't keep doing this. And you have to, there are so many promising treatments, and I know we're going to hear about them later, but like, if there's ever a time to get a bad diagnosis like this, it's probably now, because things are changing so rapidly, and there's hope. And you have to hang on to that. You have to, because you can't get through it otherwise. And you also really have to try to hang on to your sense of humor. And sometimes I make jokes and my friends look at me like gallows humor, but the truth is, you know, you can't lose that, because if you do, then you lose who you are, and this disease wins. And I am determined not to let it beat me in every form. And so that would be my advice, you know, is to try to cling to who you are and to remain optimistic that you're going to make it through this in time for there to be a cure.
Those are all excellent points by all of you. I think we do have some questions from the audience. You want me to read it? Is there one over there as well? No? Okay. What tip would the caregivers share to the care of themselves? Excellent question.
That's a really tough one, and I would say that that's an area where I feel like I didn't do the best that I could. I think you realize that the things that you did to take care of yourself previously aren't an option time-wise, and just with all the things going on, so you have to find a way to take a break in the moment. So I would actually, oftentimes, we have kind of a mud room, and I would kind of step out the side door and just stand outside and take a few deep breaths. And so just modifying how you think about things and trying to find a way to take care of yourself in minuscule points.
Thanks.
That's a good question. My wife had another disease that's not listed anywhere in medical journals. It's called AIP, Anson pants. And she had to stay active, and she would go bowling. She was on the last year bowling championship team. She played golf, very competitive, went to luncheons. Folks, this was not gonna get her. She kept a positive attitude. So I did have a lot of breaks until the very end. We had, first part of the chemo, she had a stroke because the chemo caused a stroke. She recovered 99.9%. And for the next number of months, we did well. We went to a trial study, University of Chicago, and none of us realized that this medicine also was going to affect her blood and cause a massive stroke. And so she really didn't die of stomach cancer. She died of a stroke caused by the chemo and the blood and the cancer as a combination. But even towards her last days, we got her out and got her doing stuff. So as a caregiver, I was lucky. She had a lot of breaks. I'd go play golf. I also own and run a business, so I had a lot of business issues to keep me going. So, but it is disruptive. But, you know, I was happy to do it.
Okay, thank you. Are there any other questions? You can just put your hand up. In the meantime, I'll have another question, maybe to expand on some of the things Jimmy mentioned. After surgery and the difficulties you had, you know, what things did you find or resources that you used? A nutritionist, was that helpful? What types of things were helpful to you to get through that?
So living without a stomach, when you're used to eating, you know, all the time, Well, there's top nutritionists at the, facility that I get treatment, so that was helpful. But that nutritional food, that doesn't taste the greatest, right? So finding out that I was allergic to milk was not unpleasant. I mean, it's just,
But the nutritionist helped you with some tips to get through some
you
of these
bet.
things?
I mean,
Yeah.
they just,
So you'd recommend that for other?
Absolutely. I would just tell whoever you're working with, tell your doctors, they'll give you the resources to find out how to give you a diet that will, help you get through this. And, when I first had my stomach removed, I was able to eat maybe 3 pieces of meat, like small pieces of meat, or like 1/4 of a peanut butter sandwich or something like that, a yogurt cup. And now I'm able to eat, half of a foot-long, sandwich. So, my stomach has, adapted to, to my eating habits, and I'm able to eat a lot more regular meals now, but just,
And that was how long ago, the surgery?
2010, March of 2010.
And then another thing to expand on that Jimmy said, maybe to open to the other panelists, when you got the diagnosis and you're struggling with all of this, did everyone get other opinions, or did anyone stay with one doctor? And if you went and got other opinions, did you find that helpful? Would you recommend that for the other patients? Maybe start with Linda.
Yes, we sought an additional opinion, and actually we did it multiple times throughout the course of Eric's treatment. But I think that gives you peace of mind in the tough treatment decisions you make, even if it just reaffirms what you were told in the first place. I think that's really helpful.
So for me, when I got my diagnosis, I actually thought that I had an ulcer. I was just in the middle of building, my dream home that I had been, in the works for 5 years. We had started construction on it. It was my wife and I. It was our, our second home that we had built together. And we just, started the framing of the house. My wife had just had our 3rd baby, and I am a senior manager of a large construction company in the Midwest. So in 2008 through 2010, the construction industry took quite a dip, and we had to lay some people off. So first time in 53-year history of our company that we'd ever had to lay off an employee. So an extremely stressful time for me. I thought that I was just having ulcer. So I had been treated at my local doctor for ulcer type symptoms, and none of that seemed to work. So I went in and had a scope, and when I got the results of the scope, I immediately went and got a second opinion. I had lost my first wife to leukemia 20 years ago, and probably one thing I didn't do then was get any kind of second opinions. I stayed with our local hospital, and nothing against them or anything like that. It's just her leukemia got so far advanced that it was too late to do anything else. So I learned a little bit from that lesson. I quickly got other opinions from Mayo Clinic, Sloan Kettering in New York, places all over the United States. So I was thankful that my family had the resources to get me anywhere I needed to go to get those second opinions, because I know that that's not always easy to do.
We did go, we got the diagnosis, and we went down to the University of Chicago and saw an oncologist surgeon, and he, unfortunately, his bedside manners weren't the best. He said, "Get your affairs in order. No surgery is possible." We ended up back at Evanston Hospital with a very fine doctor, and he felt he could help her, and he did help her. And then we did end up back at the University of Chicago on a trial study. So yes, that road that we're all traveling is going to have a lot of forks in it, and you're going to have to take some of those forks to get to the end result?
I have had 5 oncologists that I've spoken with about my treatment. One was my oncologist who treated me for my osteosarcoma, who's remained very involved and is like a friend. My doctor, I've had opinions from Dr. Mulcahy at Northwestern, Dr. Polite at University of Chicago. I've also had a conversation with the chief medical officer of the American Cancer Society. I'm constantly, looking. I haven't traveled all over the country yet because I think that living in Chicago, we have excellent oncologists here who deal with this issue. But I think for me, not only did it verify that what I was doing was right at this time, but I think in this stomach cancer world where, especially with my kind of cancer, diffuse gastric cancer is extremely difficult to treat long term. It likes to, it will at some point figure out a way to trick the chemo. I know that. I'm fully informed of that. And so I'm always thinking about what's going to happen in 2 months if my next scan is not good and we need to make a change. And I feel like I have an excellent team of doctors that could all weigh in about what the next option would be for me. And I feel like that's the way, that's really important to have that, because you have to turn on a dime if your next, my next scan is going to be the beginning of January. My last scan was stable, and I'm very, very lucky and feel great about that. But, I know it's only a matter of time before it's going to have to change.
Okay. Any final questions? Yes, go ahead, please.
I was 38 years old. So.
Any other questions? Final questions? Before we move on, I have one last question. Norm mentioned something about clinical trials, and we're going to be talking about that throughout the day, especially in my talk. Has anyone been on a clinical trial, or what are your thoughts on that? What was your experience? And then we'll close this session.
So I'll chime in. Eric had the chance to participate in 2 different clinical trials, and I know it will be covered later, but I think it's something that's very attractive to cancer patients of any kind, but particularly when you have a more a terminal diagnosis or a stage 4 diagnosis. So I would just say it's definitely an option, but that it's really good to investigate and consider what some of the ramifications are too. I think people see the upside, the potential for, maybe this would somehow be a cure, but I know for Eric, he suffered some really serious vision issues and some other health ramifications that came as about a part of him participating in those trials, and it affected his quality of life. But I think things don't change unless people are willing to take the risk either.
Very good.
So I had a clinical trial, and it was probably the lowest point in my cancer journey this far. When I got off my, I believe it was 5-FU, when it stopped working, because it eventually tricked the cancer, we tried a test. If my wife is here, she could tell you all these things. It's testacle. Is that a? Yeah, I've got it wrote down here, but I can't pronounce it. Testaxel study, and it failed. And I thought, man, what am I going to do? I just tried a clinical trial, and it didn't work. And hope, the window of hope starts closing. But I was assured that there was many other things we could use. That was just one of the things that we could try. So if you are thinking about a clinical trial or you're involved in that, it's not the end of the road, that's for sure.
Okay. Any final thoughts? Okay, we'll talk more about that, but that's great input. We have an.
How long were you on the clinical trial before you found out? Oh, scared the hell out of me. Jimmy, how long were you on the clinical trial?
So I started the clinical trial in January of 2011, and 90 days later, after CT showed that it was not working, they took me out right off of it.
Okay.
So.
Okay, let's thank the panel.